I'm Winifred Quinn. I live in Washington, D.C., and I'm originally from New Jersey. I work in healthcare policy. And I got involved in healthcare policy having been a caregiver to each of my parents in their last years of life. I was pretty young when they each passed away. I was in my 30s, and my mother had a chronic disease for a long time, and in especially the last year of her life, I realized that that's when my education on healthcare policy really started, because I saw so many shortcomings in it, and that really motivated me to want to do something about that. And also I was coming out and coming of age when AIDS was on the map, first on the map. You know, it was the gay man's cancer when I was first reading about it in the New York Times and the New York Daily News in the early 80s. And I was coming out at that time, and a lot of the men that I met, many are not with us now. And so that really motivated me as well to want to do something to improve health and healthcare for everyone. What am I passionate about? I think I'm passionate about a lot of things. I am really passionate about healthcare policy and making sure that as we age, we can age in place, and that we're not forced into institutions, or that we're not unnecessarily hospitalized, that we get really good care where and when we need it, that there's not a lot of red tape that stands in the way between me and my healthcare. And for not just me, but for millions of people. If I had the temperament to deal with blood and guts, I probably would be a clinician, but I've never had that ability. So here I am in healthcare policy, and trying to make a difference that way. I've been a patient with Whitman Walker for about 6 years. Really nice people, really great clinicians, very highly skilled, really great communication. I love the electronic health records system. I love to be able to email my nurse practitioner and my physician and the nurses when I need to. I also love being part of a health home where all of my care is integrated, and if I'm getting tests or if I have to go see a specialist outside of Whitman Walker, the results get sent to them, and everything is coordinated through them, and I really appreciate that. I think Whitman Walker, when they say we see you, they mean that they see the community at large, and are identifying what the needs are now and what the needs are in the not too distant future. Whitman Walker has a great history of filling the gap of care in the LGBT community and other communities that have been underserved, and they're continuing to do that. The future, in 20 years from now, I can envision that Whitman Walker will be taking care of a community of a broad range of LGBT people, from young adults and maybe even children, up to the very old. There are many more of us who are aging in place and aging in the community and staying in our own home. There are a lot of gay couples who are now having children. And I'm sure that's just going to grow pretty significantly. And so those families are going to be looking for care, one place where we can all go for our care, whether we're the adults, the parents, or the children, and maybe even the grandparents.